Hello and welcome to this English learning video. Today we are going to practice shadowing to help you improve your speaking skills. We will focus on essential English for the doctor and the pharmacy. This video is designed for basic and intermediate students. I will speak slowly and clearly. Please repeat after me. Listen to my rhythm and my intonation. Let us begin our practice now. Going to the doctor is very important for your health. Sometimes you feel sick. Sometimes you need a checkup. You need to know the right words. You need to feel confident. Imagine you are at the clinic. You have an appointment today. You walk to the front desk. You speak to the receptionist. You say hello. You say I have an appointment. The receptionist asks for your name. You give your name and your ID. Now you sit in the waiting room. You wait for the nurse. The nurse calls your name. You follow the nurse to the room. The nurse checks your weight. The nurse checks your blood pressure. The nurse asks how you feel. You are the patient. The nurse is very kind. The hospital is very clean. The clinic is very quiet. Now you meet the doctor. The doctor says hello. The doctor asks what is wrong. The doctor asks about your symptoms. You need to describe your symptoms. This is very important for a diagnosis. I have a fever. I have a very high fever. I have a headache. My head hurts a lot. I have a cough. I have a dry cough. I have a sore throat. It hurts when I swallow. I have a stomach ache. I feel a lot of pain. I feel pain in my chest. I feel pain in my back. I have a cold. I have the flu. I feel very tired. I feel weak today. I cannot sleep well. I do not have an appetite. My symptoms started yesterday. My symptoms started 2 days ago. The doctor listens to your heart. The doctor looks at your throat. The doctor checks your ears. The doctor wants to give you a diagnosis. A diagnosis tells you what is wrong. The doctor explains the problem. The doctor suggests a treatment. You need rest. You need to drink water. You need medicine. The doctor writes a prescription. A prescription is a paper for medicine. You take the prescription to the pharmacy. You go to the pharmacy to get your pills. You meet the pharmacist. The pharmacist is the expert on medicine. You give the prescription to the pharmacist. The pharmacist prepares your medicine. You ask how to take the medicine. You ask about the dosage. The pharmacist explains everything. You must take 1 pill in the morning. You must take 1 tablet at night. You must take the capsule with food. You must take the syrup every 6 hours. This medicine will help the pain. This medicine will stop the fever. This medicine will stop the cough. Sometimes the doctor gives an injection. An injection is fast and effective. You must follow the instructions. You must finish all the medicine. Let us practice more phrases for the clinic. I need to see a doctor. I need an appointment. Is it an emergency? No, it is not an emergency. I just need a checkup. I want to stay healthy. The doctor is very professional. The nurse is very helpful. The hospital is very large. In an emergency you call an ambulance. An ambulance is very fast. The paramedics help you in the ambulance. They take you to the emergency room. The doctors work hard in the emergency room. Sometimes a patient needs surgery. An operation can save a life. But today you only need a checkup. You are feeling a little sick. You have a headache and a fever. You have a cough and a cold. You tell the doctor about the pain. The doctor gives you a prescription. You go to the pharmacy. You buy the medicine. You talk to the pharmacist. You take your tablets. You take your syrup. You feel better soon. Repeat these words with me. Doctor, nurse, patient, hospital, clinic, appointment, checkup, diagnosis, symptoms, pain, fever, cough, headache, prescription, medicine, pharmacy, pharmacist, pills, tablet, capsule, syrup, injection, treatment, emergency, ambulance, surgery, operation. These are the most important words. Let us use them in more sentences. I have an appointment at the clinic. The nurse is checking my symptoms. The doctor is making a diagnosis. I feel a sharp pain in my arm. I have a high fever and a bad cough. My headache is getting worse. I need a prescription for my medicine. I am going to the pharmacy now. The pharmacist is giving me the tablets. I prefer the syrup for my cough. The doctor says I do not need surgery. I am happy it is not an emergency. I do not need an ambulance. I just need some rest and treatment. It is good to practice these phrases. You will feel more comfortable at the hospital. You will understand the doctor. You will understand the pharmacist. Communication is the key to good health. If you feel pain, you must say it. If you have a fever, you must check it. Always tell the truth about your symptoms. The doctor is there to help you. The nurse is there to care for you. The hospital is a place of healing. The pharmacy is a place of help. Let us review the symptoms one more time. I have a headache. I have a fever. I have a cough. I have a sore throat. I have a stomach ache. I have a cold. I have the flu. I feel pain. I feel tired. These are common symptoms. Now let us review the medicine. I need pills. I need tablets. I need capsules. I need syrup. I need an injection. I have a prescription. I go to the pharmacy. The pharmacist helps me. This is the routine. This is the process. You are doing a great job with your shadowing. Your pronunciation is improving. Your confidence is growing. Keep repeating the sentences. Listen to my voice and copy me. Imagine you are talking to the doctor again. Hello, doctor. I do not feel well. I have a headache and a sore throat. I also have a dry cough. My symptoms started this morning. Do I have a fever? The doctor checks your temperature. Yes, you have a slight fever. You need some medicine. Here is your prescription. Take this medicine twice a day. Drink plenty of liquids. Get a lot of sleep. Thank you, doctor. Now you go to the pharmacy. Hello, I have a prescription. The pharmacist looks at the paper. Here are your tablets. Take 1 tablet after breakfast. Take 1 tablet after dinner. Do not skip a dose. Thank you, pharmacist. Have a nice day. You go home and you rest. You take your medicine. You feel much better the next day. The treatment is working. Your health is returning. It is very simple when you know the words. English for health is very practical. You use these words in every country. You use these words in every city. Whether it is a clinic or a big hospital. Whether it is a small pharmacy or a large one. The words stay the same. The people are there to help you stay healthy. Remember to be polite. Use words like please and thank you. Say excuse me when you have a question. The doctor will appreciate your effort. The nurse will appreciate your kindness. Let us practice the key vocabulary again. Doctor, nurse, patient, hospital, clinic, appointment, checkup, diagnosis, symptoms, pain, fever, cough, headache, prescription, medicine, pharmacy, pharmacist, pills, tablet, capsule, syrup, injection, treatment, emergency, ambulance, surgery, operation. Say them clearly. Say them slowly. Now say them a little faster. Doctor, nurse, patient, hospital, clinic, appointment, checkup, diagnosis, symptoms, pain, fever, cough, headache, prescription, medicine, pharmacy, pharmacist, pills, tablet, capsule, syrup, injection, treatment, emergency, ambulance, surgery, operation. Very good. You are mastering the vocabulary. The process of recovery takes time and patience. Every patient wants a fast recovery. You must follow the medical advice for a good recovery. Sometimes recovery happens at home. Sometimes recovery happens in the hospital. Your medical record is a history of your health. The doctor looks at your medical record to see your past illnesses. It is important to keep your medical record updated. Always tell the doctor about your medical history. This helps with a correct diagnosis. Do you have medical insurance? Medical insurance helps pay for the hospital. Medical insurance is very important in an emergency. The clinic asks for your insurance card. You give your insurance card to the receptionist. The nurse checks your blood pressure. High blood pressure can be dangerous. Low blood pressure can make you feel dizzy. The nurse uses a cuff to check your blood pressure. Now the nurse checks your temperature. A high temperature means you have a fever. Your temperature is 38 degrees. That is a high temperature. Do you have any allergy? I have an allergy to penicillin. I have a food allergy. It is vital to report every allergy to the doctor. An allergy can cause a reaction. The doctor needs to know about your allergy before giving medicine. You might have an infection. A bacterial infection needs an antibiotic. You must take the antibiotic for 7 days. Do not stop taking the antibiotic early. A virus is different from bacteria. You cannot treat a virus with an antibiotic. The flu is a virus. A cold is a virus. Your body fights the virus with rest. Sometimes you need a painkiller. A painkiller helps reduce the pain. A painkiller makes you feel more comfortable. Take the painkiller every 8 hours. Be careful with the dose. The dose is the specific amount of medicine. A high dose can be harmful. A low dose might not work. Always follow the instructions on the label. Read the instructions carefully. The instructions tell you when to take the pill. The instructions tell you if you need food. Some medicines have side effects. A side effect is an extra reaction. Drowsiness is a common side effect. Dizziness is another side effect. Tell the doctor if you feel side effects. If you run out of medicine, you need a refill. You call the pharmacy for a refill. The pharmacist prepares the refill for you. Some prescriptions do not allow a refill. You must see the doctor again for a new prescription. If you have a cut, you need a bandage. The nurse puts a bandage on the wound. A wound must stay clean to avoid infection. Wash the wound with soap and water. Change the bandage every day. If the wound is deep, you might need stitches. The doctor examines the wound carefully. Sometimes the doctor needs a test. A blood test provides many details. You go to the lab for a blood test. The doctor might order an X-ray. An X-ray shows your bones. You go to the X-ray room. You must stay very still for the X-ray. The technician takes the X-ray. Now you must wait for the results. The results will be ready tomorrow. The results will be ready in 1 week. The doctor looks at the results. The results show that you are healthy. The results show a small problem. You might need to see a specialist. A specialist is a doctor for one part of the body. A cardiologist is a heart specialist. A dermatologist is a skin specialist. You need a consultation with the specialist. The consultation is a long meeting. You discuss your health in detail. The specialist suggests a new treatment. You go back to the waiting room. The waiting room is full of people. Please wait for your name to be called. The nurse calls you again. We need to check your blood pressure one more time. Your blood pressure is normal now. Your temperature is back to normal too. The infection is gone. The antibiotic worked very well. The virus is no longer a problem. Your recovery is almost complete. Continue taking the painkiller if you feel discomfort. Remember the correct dose. Follow the instructions for the refill. Keep the bandage on the wound for 2 more days. The wound is healing perfectly. The results of the X-ray are positive. There are no broken bones. The specialist is happy with your progress. Let us practice these words again. Recovery. Insurance. Medical record. Blood pressure. Temperature. Allergy. Infection. Virus. Bacteria. Antibiotic. Painkiller. Dose. Instructions. Side effects. Refill. Bandage. Wound. Test. X-ray. Results. Specialist. Consultation. Waiting room. These words are essential for intermediate learners. Repeat after me. I am focusing on my recovery. I have private medical insurance. The doctor is reading my medical record. The nurse is measuring my blood pressure. My temperature is normal today. I have a seasonal allergy. The doctor is treating an infection. A virus can spread quickly. Bacteria are very small organisms. I need an antibiotic for my throat. This painkiller is very strong. What is the correct dose for this medicine? Please read the instructions on the bottle. I am worried about the side effects. I need a refill for my heart medicine. The nurse changed my bandage. The wound is starting to heal. I am waiting for my blood test. The X-ray shows a small fracture. The results were sent to my email. I have a consultation with a specialist. I spent 1 hour in the waiting room. The clinic is very busy today. Many patients are in the waiting room. Some people have an allergy. Some people have a virus. The nurse is busy checking blood pressure. The doctor is busy with a consultation. Every patient has a medical record. Every patient wants a fast recovery. You see a man with a bandage on his arm. He has a wound from a fall. He needs an X-ray to check his elbow. He is waiting for the results. The specialist will see him soon. The specialist will decide the treatment. He might need an antibiotic or a painkiller. He must follow the instructions for the dose. The pharmacy is also very busy. People are asking for a refill. People are buying medicine for an infection. The pharmacist explains the side effects. It is important to understand the side effects. Some medicine makes you sleepy. Some medicine makes you hungry. Always ask the pharmacist if you are confused. The pharmacist knows about every dose. The pharmacist knows about every antibiotic. The pharmacy is next to the clinic. It is very convenient for the patients. Your medical record is private. Only you and your doctor can see it. It contains your test results. It contains your X-ray images. It contains your list of allergies. If you change doctors, you need your medical record. You can ask for a copy at the clinic. Your insurance might cover the cost. Check with your insurance company. Some insurance plans are very good. Some insurance plans are basic. Let us practice more sentences for shadowing. My recovery is going very well. I showed my insurance card at the desk. My medical record is at this hospital. The nurse said my blood pressure is perfect. I have a high temperature and a chill. Do you have an allergy to any medication? This infection is very painful. The doctor said it is a common virus. Bacteria can cause a fever. I finished my course of antibiotics. I take a painkiller for my back. The dose is 2 pills every day. I always read the instructions first. I did not experience any side effects. I called the pharmacy for a refill. Put a clean bandage on the wound. The wound is not very deep. I need a blood test on Monday. The X-ray did not show anything bad. I am waiting for the test results. The specialist is an expert in this field. My consultation lasted 30 minutes. There are no chairs left in the waiting room. Health is the most important thing. We must take care of our bodies. We must listen to the specialists. We must follow the treatments. When you feel sick, go to the clinic. Talk to the nurse and the doctor. Be clear about your symptoms. Be clear about your pain. Do not forget your medical record. Do not forget your insurance. If you need an X-ray, do not be afraid. If you need a test, it is for your benefit. The results will help the doctor. The diagnosis will lead to a recovery. Take your medicine and watch the dose. Watch for any side effects. Keep your wound clean with a bandage. Use the refill if the doctor says so. Stay calm in the waiting room. Everything will be fine. Repeat these phrases one more time. Recovery is a process. Insurance provides security. My medical record is complete. Check your blood pressure regularly. Monitor your temperature every hour. An allergy can be serious. This infection requires attention. A virus cannot be cured with antibiotics. Bacteria are everywhere around us. Take the antibiotic with water. A painkiller provides quick relief. Never exceed the recommended dose. The instructions are very clear. Side effects are usually mild. The refill is ready for pickup. Change the bandage twice a day. The wound is closing now. Your English is getting better every minute. You are becoming an expert in medical English. This knowledge is very valuable. It can help you and it can help your family. You can explain your problems to any doctor in the world. You can understand any pharmacist. You are a successful English learner. Keep going. Shadowing is the best way to learn. It helps your brain connect the sounds. It helps your mouth move correctly. You are training your muscles. You are training your ears. Keep practicing every day. Practice with this video many times. Each time you will get better. Each time you will be faster. Your English will sound natural. Your English will be clear. I hope you found this video helpful. Learning how to talk about health is essential. Now you can go to the doctor with confidence. You can go to the pharmacy without fear. You know how to describe your symptoms. You know how to ask for medicine. You understand the diagnosis. You understand the treatment. You are a great student. Thank you for practicing with me today. If you enjoyed this video, please give it a like. It helps the channel a lot. Do not forget to subscribe for more English lessons. Click the bell icon to get notifications. We have many more videos for shadowing. We have many more topics to cover. Keep practicing and keep learning. See you in the next video. Goodbye and stay healthy.